Hi there, my name is Sharon Whiteman, and welcome to this quick presentation to help you understand the situation with Australian Lyme disease or Australian Lyme-like illness. My name is Sharon Whiteman, as I just said. I'm currently the president of the Lyme Disease Association of Australia. And I'm also a Lyme patient. I got sick from a tick bite on the Sunshine Coast in around 2002. It took me about 5 years to work out what was going on with me, and that was through a chance meeting with an American doctor. And at that point, I was unable to function. I couldn't walk unaided. I no longer could drive. I was having difficulty remembering my family's names. I was in pain 24/7. And I'd had a tick bite and I had a bullseye rash. I just didn't know the significance of that, nor had the 17 doctors I'd seen up to that time trying to work out what was wrong with me. Sadly, that really didn't change. I sent my blood overseas to America at that time. It came back positive, and I still couldn't find anybody to help me. Fast forward till to now, I recovered to functional level, into a quality of life through a treatment that my mother-in-law found online. It's very alternative, but it got me back into being able to function. And in 2012, I was feeling fairly, I'd say you could call it depressed. I was sort of finding it impossible to really feel good about my life. I guess I was focusing more on what I'd lost than what I still had. And so I made a decision to put my hand up to volunteer more with the Lyme Disease Association. And here we are today, 5 years later, still working to get recognition for Lyme patients in Australia. So if you haven't heard of Lyme disease, it's easy to be skeptical, because if you look on the government website, it says it's not here, and most of the media will have the naysayers on there to say, no, there's no evidence of it. And I hope to enlighten you with some of the facts here today. So it's an infectious disease. It's caused by bacteria from one of the strains, Borrelia. And that's how it was originally in the 1980s discovered. It was in Lyme, Connecticut. And there was a cluster of young children with arthritis, and they ended up finding this bacteria in their blood. If you fast forward to today, it's now considered more an umbrella term as opposed to a single pathogen illness. So it's no longer just about Borrelia burgdorferi. It's known to be transmitted through biting insects, and historically, again, it's mostly ticks, but there is evidence emerging worldwide, not in Australia, but evidence emerging worldwide to show it's found in mosquitoes, in march flies. Doctors report a lot of people coming back from Bali having bitten by bed bugs. So really have to be concerned about any kind of flu-like illness after any type of bite. It's a vector-borne illness. The World Health Organization says it's both preventable and treatable. It's the fastest growing vector-borne disease. Up to 300 strains of Borrelia reported globally. They're not all tested, though, for their potential ability to make humans sick. But I think there's about 13 to 18 that they now know that can cause a Lyme-like, very slightly different symptom picture with some of them, but a Lyme-like illness. In 2014, the Environmental Protection Association in the US added Lyme disease as an indicator of climate change. So it's now being found in areas where it previously didn't thought to be endemic. Germany estimates about 60 to 100,000 new cases annually. China indicates about a 5 to 6% of their population. That's 5 to 6% of 1.3 billion people. We're very close to China, aren't we? But we have this little dome over Australia, excuse my cynicism. Birds can be hosts, so anywhere birds fly, it's found in seabirds in the Antarctic. They're getting bird studies out of California and out of Canada, and some of the studies are showing 49% of the ticks on these birds that migrate actually have Borrelia positive pictures. So if you can imagine, they're not, those ticks, you can't even think about it as where the ticks can roam. They are transmitted. And we've had multiple deer farms in Australia, and up here on the Sunshine Coast, they're financially unsuccessful. So the deers were just left to go in the wild. Same around the west side of Brisbane as well, people report to us. So, you know, there's no border testing or surveillance for any kind of ticks on, you know, racing horses, cattle, any livestock that are brought into Australia. Putting it into perspective, and this is often shocking to many people, this is a graph showing the incidence, this is US pictures, of West Nile, HIV, breast cancer, and Lyme disease. So there's something seriously wrong with that picture. I think we all would nod our heads if, you know, if I could see you right now. We all know that there's far more money and research thrown at those first three diseases, and nothing is happening with Lyme disease until the last year. So Lyme disease has been diagnosed in every state of Australia. We have over 15 medically confirmed cases have been reported to our organization. Australian Lyme treating doctors indicate that more than 4,000, some estimate up to 8,000 have been treated over the years. We've got people in city areas, bush areas. There really isn't anywhere immune. They can occur at any time of the year. It's not just tick season. 70% of our survey respondents don't remember a tick bite. 25% had never left the country. And really looking at it, the first evidence of Borrelia in Australia was in the 50s and 60s through the CSIRO. There was a Queensland, Borrelia queenslandica found in the 80s. There was some research on New South Wales discovering Borrelia in the late 80s to the 90s. So we expect that Lyme disease incidence here is exactly mirrored per capita to the US because we're discovering it here. It's just that one prestigious research project, what I'll talk about in a second, seemed to negate any other evidence. And then we've had an absolute vacuum of research or surveillance since 1994. So that's almost 25 years now. We're moving to with denial of a disease while Australians have been sick, suffering, and in some cases dying. So this is, again, a similar picture. The other picture was tick bites reported, and these are homes with people suffering and diagnosed with Lyme disease around Australia. It looks pretty close to the same prevalence. Now, this is an incidence. This is the timeline that I was just talking about. So you can see here on the left, from 1959 was one of the first Borrelias isolated in fauna. In 1959, then there's more evidence. It's 1976. It was isolated in the US. Hunter Valley, 1982. Lyme diseases reported on New South Wales South Coast in 1986. And then the Wills and Berry study is what I'm highlighting there in 1991. They had positive Borrelia in patients and confirmed with the US lab that discovered Borrelia burgdorferi. Willie Burgdorfer's lab confirmed her results, and excuse me. And for whatever reason, the 1994 Russell and Doggett had study discounted anything previous, and that's been the only study that's been referred to since then. Fast forward to 2002. There's Dr. Peter Main has positive. Then we've got Main in 2015, and then Professor Irwin out of Murdoch University in 2015 discovered 5 novel species of pathogens in Australian ticks. Sadly, he's a veterinary researcher, so he couldn't link his discovery to human health, but he's currently in the process of a pilot study with Lyme patients. So he's studying human blood with a medical partner, and he's predicted to have, he's hoping to have his first 6 months overview interim report within the next couple of weeks. So we'll see. It could find something, it might not. It may show that they need to improve or adjust their methodology, but at least they're looking. So that's another snapshot of the previous evidence, and another snapshot saying when it was denied, and another snapshot outlining the new research that's currently happening. So in the journey to recognition, in 2012, right around the same time as I started as president of this organization, simultaneously to that, they announced a clinical advisory committee onto Lyme disease. We lobbied and got a patient representative, a consumer rep on that committee. We submitted to the scoping study. And that study wrapped up, that committee wrapped up after 5 meetings because they couldn't have a discussion ultimately. There wasn't a term of reference that was strong enough for people to say, you know, listen, we're not here to talk about what's not here. People are sick and we're looking to find out what's going on. So that wasn't happening. So Professor Bagley, the chief medical officer at the time, wrapped it up with a report in 2014. In 2014, he also confirmed in that report from the Clinical Advisory Committee that our blood testing was discordant. So ultimately, since 2014, the government has known that Australian labs aren't able to effectively test for Lyme disease. And so far that hasn't been corrected. And I can guarantee if you rock up to a doctor's office, 90% of the time, I would guarantee that they'll send a blood test off that comes back negative. They won't tell you that there's a problem with the blood testing. Why that information doesn't filter down to the doctor's office, I'm not sure. Then we've continued to lobby through a postcard campaign in 2015. We had a House of Rep roundtable in 2015 with more evidence being exposed. And then we had in 2015 and 16, a Senate inquiry into Lyme-like illness in Australia. They had 4 public hearings, and that reported last November 30th, and we're awaiting a government response. It's been imminent since June, and I'm telling you, I'm sure the health minister's advisor might be considering calling me a stalker by now, but I'm really chasing him to get some evidence. So I'm not sure when you're watching this, so I'm giving you some of the dates so you know that things might have changed if you're watching this in a delayed fashion. Also this year, the health minister asked the NHMRC to fast track the research they did a targeted call for research into Lyme-like illness, and they asked them to fast track the outcome. So there's another committee currently happening and meeting to determine the research questions, which will then go to tender or to the grant process in 2018. So we assert that a single 20-plus-year-old study cannot be used for the basis of ruling out the possibility of an Australian Lyme disease. There's no argument, and there's plenty of evidence on record now. You can read any one of the 1,200 plus submissions. For those of you that are feeling, you know, having a difficult time questioning the government or questioning your doctor, go take a read. You read some of those submissions, you'll never have another doubt that people are getting sick in Australia after tick bites. There's no scientific validity in denying positive blood tests in people. So right now, because they haven't found the evidence in a tick, when a person's blood test comes back positive, they say it's a false positive because our ticks aren't competent to carry the bacteria. Well, we haven't even looked at our ticks for 20-some years, except with the exception of Dr. Irwin or Professor Irwin from last year. So any scientist worth their grain of salt would not stand up and definitively say nothing is here when there's been little or no evidence, and research methodology has improved so much in the last 25 years. In emerging disease situations, patients are the evidence. So what happens when a disease is emerging in a certain area or in a country, patients are getting sick and they're showing up and they go, hey, there's something wrong here. We need to look at this, as opposed to, no, it's not here, there's something wrong with you, or this is a mental illness. So we'd like to challenge the government and saying that they're failing in their duty of care, both in human rights and human health. And it's decades of decisions of not acting on emerging evidence. So in the case of scientific uncertainty, patients still have a human right for humane, compassionate, and world-class treatment and care. So what is it? How does it present? If you get a bite, and actually 30% of people don't remember a tick bite. Internationally, I think that statistic is more like 50% of people don't even ever remember a tick bite. They're tiny, they can be the size of a pinhead, and they have sort of a little anesthetic when they bite, so you typically don't feel it. That picture you see on your screen now is called a bullseye rash, and that is diagnostic of a Borrelia infection. They used to think it was only Borrelia burgdorferi, which was the US endemic strain of Borrelia. They now know that they've now discovered, I think, Miyamoto, and there's another one that I can't remember the name of, also has bullseye rash. So again, that's embracing the umbrella term of Lyme disease, which means a multi-pathogen illness. It's not definitively linked to just Borrelia burgdorferi. The most common thing that people report is a flu-like illness, which obviously, you can understand why doctors might miss that, because we get flus all the time. But if you are it associated with a rash like this or a bite of any kind, then it needs to be considered. And the early detected Lyme disease can be treated really easy. Well, for most cases, not probably 90% of people get better with immediate antibiotics. And the antibiotics, you can't say everybody recovers after 4 weeks of antibiotics, minimum 4 weeks. I would say 6 weeks, and you need 2 antibiotics. And if your symptoms aren't gone after 6 weeks, then you extend the antibiotics until you're symptom free. That's the highest rate of potential recovery. Sadly, in Australia, the average time to diagnosis is 10 years through our surveys. The bacteria in that time has spread into tissues and organs. As a matter of fact, they now have proof that it's out of the bloodstream into tissues and organs within 24 to 36 hours. It's typically an invisible illness, Lyme. So you look at someone, if you looked at me, you wouldn't know what I suffer daily. People just think I look normal. I may get up a bit slower, walk a bit slow, and I've gained 30 kilos through this. So they'll just say I'm fat or I eat too much, which is none of the truth. So you can't really look at someone and know how much they're suffering. And in Australia and globally, this is true globally, but since it's denied here, even more so true here, is that it's typically misdiagnosed as a different disease. So multiple sclerosis, rheumatoid arthritis, Alzheimer's, motor neuron, Lou Gehrig, Parkinson's, lupus, chronic fatigue, sarcoidosis, ADD, autism, and there's even more. So if you have a diagnosis, one of those I've listed, or another diagnosis, and it's atypical, or you don't quite fit that, but they're trying to, squish a round peg into a square hole, then you actually have the right to be re-evaluated with Lyme disease or Australian Lyme disease or Lyme-like illness, whatever you want to call it, to be included as part of your differential diagnosis. So we assert that anyone should have that human right in Australia today, and you may need to persist. So I had a friend recently diagnosed with motor neuron disease, and she was sort of planning her life for the next 2.5 years before she died. And I asked her if she had a history of tick bites, lots of tick bites. So she's now going through the process. And I tell you, we had to phone quite a few numbers before we found a doctor willing to write the requisition for Lyme. Her GP wouldn't do it. Says, no, I won't help you. So sadly, they're only listening to what they're told. But if you have an inquiring mind, it doesn't take much to see there's a lot of gaps in the story here. So, and as I already said, it's Borrelia and more, so there's many strains. And Dr. Horowitz, he's saying 100 US strains. In the majority of cases, it's a cocktail of pathogens or a constellation. And you can see the lists on there: parasites, viruses, bacteria. So it's very complex to treat, and it's very debilitating to get, I can tell you. And depending on the genetic makeup and the health of the human organism and the cellular health, their genetic health, some will get really sick and some won't until maybe they are reinfected at a later date, and it's sort of like a total load that overwhelms their immune system. So that's why it's such a varied, there are clear patterns of symptomatology, but it's unique in every patient at the same time. And that's why it's very difficult. And doctors need to have a lot of experience. And to be fair, many of the doctors are hesitant to treat because it is such a complex thing. They feel underskilled. They feel like they need more help. And it's really hard to find that. It's like a little secret underground group of doctors who are willing to, who are committed to doing the right thing by patients and willing to put their livelihood on the line for their oath, basically the Hippocratic oath that they signed up for. So world's best practice is that Lyme disease is a clinical diagnosis. So you actually don't need a positive blood test to have a diagnosis of Lyme disease for all the reasons I've already said. Lyme disease is very quickly out of the blood. And the other reason is, there's a few reasons, but to simplify, the other main reason is that the immune system can be overwhelmed very quickly by these pathogens. And some of the early tests, the first test is usually they look for the antibodies. So look at what the immune system has mounted a response to this pathogen. Well, typically the immune system is very quickly overwhelmed and there is no response. And sometimes it only gets positive later down the track. With treatment, the total pathogen load is decreased, and then the immune system has a chance to get back on its feet and start working again. I think most of this is repeated. And there's a lot of, I guess, speculation right now that one of the Australian strains will be a relapsing fever, Borrelia. It's sort of like a cousin to Borrelia burgdorferi. And I support that theory. I think that's true. I also know that I was tested positive for Borrelia burgdorferi from a tick bite here in Australia. So I know once they have time and as research methodology improves in Australia, I know they'll be finding more than one strain. And that's happening everywhere. Lyme disease is on every continent in the world. It's inconceivable that it's not here. So treatment, as I said before, you need to go beyond symptoms. And if it's a chronic situation, like I was 5 years sick, many people are being diagnosed after 20 and 25 years in Australia, then it's really probably a lifetime treatment schedule, and you can hope to have quality of life back. You may never recover to your fully healthy self, but you can get quality of life. You don't have to stay suffering so badly. You can get legitimate care and treatment. It's a marathon, not a sprint, and it requires a very multi-pronged approach, because especially for advanced situations where they've been sick for a long time, everything is sort of breaking down from the detoxification pathways. So you need we recommend a multidisciplinary and also an integrative approach. So you'll need a lot of natural medicine as well as Western medicine. As a matter of fact, as a quick story, the president prior to me, immediately preceding myself, her whole family was sick with Lyme disease. She had to go overseas to get treatment. She was diagnosed with motor neuron. She was in a wheelchair for 7 years, and obviously atypical motor neuron, because that's a long time. And she's now, I would say fully functional. I don't know if she's fully healthy. She still has some lingering symptoms, and she still treats with herbs. But in her family, some of them only responded to antibiotic treatment, and some genetically only responded to a more herbal and natural medicine treatment. So you obviously need very flexible and knowledgeable practitioners to troubleshoot with each individual patient and see what's going to work for them. And left untreated, Lyme disease can be fatal. There are several deaths in Australia, and very, very sadly, we've had 7 suicides in the time that I've been involved in. They're mostly all young people. Just terrible, terrible situation. So over 50%, so the burden of this disease, not only financially, but on their impact of life, is outlined here. Over 50% of people have to travel longer than 50 Ks for treatment. 130 in 2014 traveling to Germany. There's way more than that now. There's hundreds that have gone to Cyprus. They're going to Malaysia, they're going to New Zealand, and they're going to the US, and they're going to Mexico, because you can't actually there's a handful of doctors that are so overworked, most of them that are willing to do this. Their books are closed and overwhelmed. There's long waiting lists. So Australians are forced to being medical tourists and going overseas. About 70% reporting having to quit or take time off. 50% had to quit, actually. 38% report suicidal feelings, and definitely I've been there many times with this disease. It is such a torturous experience. And everyone reports significant decline in quality of life, gross deficits in their functionality, increasing social isolation exacerbated by having a long-term illness where you're denied care, you're vilified, you're ridiculed. I've had to go accompany moms with their pediatrician where community services is threatening to take their child away because the mom's insisting that they have Lyme disease, when the fact is she's got a positive blood test and a known tick bite and a known rash, all well documented, but they're threatening. We're able to sidestep that. I've had somebody kicked out of the hospital who couldn't walk, and they said it was a mental illness issue. And this is happening in every state and territory and every hospital across Australia. And 100% of people have extreme, with rare exceptions, extreme financial devastation of their home, family, and their personal situation. So this is a quality of life. This is compared to other diseases. So you can see on the tallest one there, chronic Lyme disease, 72% impact of disability on their life, more than congestive heart failure, fibromyalgia, diabetes, MS, depression, asthma, and the general population. So this is looking at their quality of life. It is a devastating illness. And if you're skeptical, nobody would understand really without living a minute in one of our bodies, sadly. And I think it's really important. This is probably one of the most important slides, is to really understand and be compassionate. And if you're around someone or you know someone that has Lyme disease, just believe them, and believe when they look okay and they say they're terrible, because it's true. They do get better. The good news is they do get better with treatment. And I went from being completely disabled to functional, and I have quality of life. And one of the highest values for me is being able to contribute. And since I've been contributing, it's been challenging. It's a very political role, but we've been able to make a big difference. And at least I'm able to contribute to the world, even though I'm incapable of doing what I used to be able to do. I was a critical care nurse. I had my own business. I was very active. And now I'm not housebound, but I can't stand up long or walk far. I have very impacted quality of life. So make sure, if you know someone that's had a tick bite, has a weird flu after any unexplained illness that they just can't get an answer for, they should be evaluated for Lyme disease. Be persistent. You may ask me to, like I did, I was helping my friend, and even though I'm in the know, it took us several times before we got someone that could see her within a week and write blood tests and was willing to support that. Again, help people get reevaluated if they've got an atypical diagnosis. We recommend that all Lyme patients seek peer support. You need to connect with other people in the same and similar situations and go on there. I think Lyme patients are some of the most knowledgeable patients on the planet, because they've had to become their own doctors ultimately. And they, find the right support group for you. Don't stop at the first one if it's not a fit, but get supported in the way that feels right for you, whether it's a face-to-face or an online support group. And probably the next most important message is be tick smart. If you have any bite that has a weird rash and a flu at, get antibiotic treatment right away. I'm really committed to natural medicine. I guess I feel probably even more betrayed by the medical group, because it was my career for 20 years. I was a very dedicated triple certificate critical care nurse, loved it. I worked really hard at it. And so I think I felt really betrayed at my experience that I've had at the hand of doctors where, I had terrible treatment. So avoid being in our situation. Take tick bites seriously. And if you're sick, be aggressive in finding treatment and reach out to us. You can show here that the best way that, that's evidence-based to date is to use needle nose tweezers or a claw-like thing, and don't squish the body of the tick, because there is evidence that it injects more saliva, which carries the pathogens. There is a lot of recommendations right now of using the freezing spray. If you have an anaphylactic allergy to tick bites, absolutely use the freezing spray. But just so you know, the government has announced that actually hasn't been tested for safety. But I tell you, if I had anaphylaxis, obviously that would be my choice. And possibly for the nymph ticks, we get reports of people where they've been in a nest and they've got, say, 150 nymph ticks that there's no way you could get anything underneath. We recommend, a warm bath with baking soda in it, but I'd probably be tempted to use the freezing spray in that kind of situation as well. But just note that it's not studied yet. Be Lyme disease savvy. These are very important reminders in summary. Understand that not all medical professionals are Lyme aware. There's no one doctor that's right for every patient. You need to persist until you find a match for you, and that may include seeking overseas consultation. Really remember, our blood testing is broken in Australia and they haven't fixed it. They did commission a study that was due to be reported in last February, but now they're linking that with the government response to the Senate inquiry, and they're holding on to those outcomes. I'm not sure what they show. And even in world's best practice blood tests, you may still not get a positive blood test and still have Lyme disease and respond and return to quality of life with treatment. Majority by far are misdiagnosed with something else first. Always treat symptoms and don't stop until the symptoms have resolved. And the sooner you start treatment, the better the outcomes. And make sure other people hear about this. You'll know of people, gee, I didn't feel well after I got that tick bite, but my doctor says it's okay. Get them to check again and get them to reach out to us. So we're a small charity. We're doing big work, and it's very important work. We lobby to the government. We educate the public. We advocate for early diagnosis and treatment. We're supporting and collaborating for the progress of patient-focused research, and that's what we'll be advocating on this NH and MRC committee via the consumer rep. You know, we want research out of this $3 million that have been allocated that actually focuses on making a difference for patients sick right now. We couldn't really care less if they looked at another tick. That's not a priority to help people that are sick right now. And they've ultimately, the government has dropped the ball for 25 years. They don't have the right now. They don't have the luxury to look at ticks. We really want to improve quality of life for patients suffering Lyme disease in Australia. So thank you for giving this time to educate yourself. Make sure you pass it on. You can help by volunteering for us. I know a lot of people are retired or have extra time and know that it's important to give back. And one of the great things about working with us is it's mostly virtual. We're all over the country, so you can do from your own home. Spread the word. We've got flyers and we've got our website, which will be updated in the next 6 months. We're rewriting it now. We've got Random Acts of Lyme campaign on our website. Sometimes that'll spark some ideas of what's the right way for you to take action in supporting of us. You can purchase merchandise, you can donate money. If you've got less time and more money, we'd appreciate every action on our behalf. So Lyme awareness saves lives. You knowing this may help someone else or yourself or someone in your family. We appreciate you and thank you for listening. Have a great day.